Thanks for joining us this afternoon. I'm Nancy Furness, and this is We've Got Issues. We're filming at the Coquitlam City Centre Library today, and we'd like to thank the library for providing us a venue to do these interviews. Also like to thank Tri-Cities Community Television for filming the interviews. Before we get started, I just want to acknowledge that the interviews do take place on the traditional, ancestral, and unceded lands of the Coquitlam First Nation. So we thank the Coquitlam people who continue to live on these lands and to care for the lands and the waters and all that lie above and below. Today we're joined by Roxanne Saxon from Tri-Cities Community Action Team. So thank you so much for joining us today, Roxanne. Can you tell us a little bit about the Tri-Cities Community Action Team, what your group does, and maybe how it got started?
Yes, so in 2016, on April 14th, there was a public health emergency crisis that was declared due to the high drug-related overdoses. So one of the responses from the government, they initiated some strategies and came about the community action teams. So across the Lower Mainland, there's going to be different community action teams in each city. Okay. And in 2017, our Tri-Cities Community Action Team formed. So the goal of the community action team, it will change yearly, but from what we kind of broke it down to is breaking down stigmas within the community, connecting resources, education, and then creative visuals.
Okay, that's interesting. That gives us a really good bit of insight into what you're doing. Can you talk about, you mentioned about connecting services. What kind of services are you talking about? Like what other organizations do you work with?
So underneath the TCAT, we have Access Youth Services, there's the SHARE, we have naloxone, Safe and Sound First Aid Training. We do have a lot of our volunteers come from naloxone, and then first aid training we have with Jill McCulloch. Yeah.
Okay, so you actually have the public coming in and being trained on how to use the naloxone?
Sometimes we do. So at local community events, we will do some naloxone training, but also with naloxone, we've really supported them going into the schools and teaching youth about it. And then now they're able to do the naloxone training as well, outside of just talking about the crisis.
Okay. Yeah. I've always been interested in that, but not quite sure how to go about, being trained or what it involves. Can you talk a little bit about what you do with naloxone, when you would use it, and how you would use it?
Yeah, so with naloxone, you can get it at any local pharmacy. It comes with 3 syringes, it has 3 ampules, with 3 doses of the medication. You would walk through the Save Me steps, so that's stimulating, just making sure they're not just sleeping, having a nap. So just trying to stimulate them.
How would you do that sternal rub?
The sternal rub, you can kind of just like kick their foot a little bit. Just
talk to them?
Yeah, some people aren't comfortable like touching, so okay. Yeah, talking, just being loud, like, hey, I'm here, I'm just trying to save you. Check, make sure you're okay. Checking the airway. A lot of the times it's people are just, they're not getting that oxygen.
Right.
So just checking their airway, making sure there's nothing in the mouths. Putting them in the recovery position. Breaths are huge. We're finding now with more than just fentanyl, so naloxone does respond to fentanyl and opioids, but it won't respond to like benzodiazepines and the xylazines that are getting mixed in with substances.
Oh wow, okay.
So a lot of the times the breath work is the most important, just kind of keeping that oxygen flowing to the brain. I should say, back up a little bit here, we need to call 911.
So that's the first thing you would
step,
do?
Yes.
Okay.
Yeah, so you want to make sure the paramedics are on the way just in case
Right.
like it's the fentanyl, the naloxone's not going to react. So after you're ventilating, then you're evaluating the situation, and then you would be giving the medication into the thigh or to the arm.
And you can give it right through clothing?
Yeah.
Okay. Yeah. It's an emergency, I guess, at this point. You don't...
Yes.
Yeah. How can you tell? Like, what would be some of the signs that somebody is in that space? Is it because they're not conscious and they're not responding?
Yes, unconscious, they're not responding. The lips may be turning purple.
Oh, okay.
Sometimes gurgling. People are gurgling that they can't.
Trying to breathe.
Trying to breathe. Yes.
Okay. So. And what happens after you inject the naloxone? What could somebody expect to see happen?
So you want to make sure the paramedics are on the way because the overdose can come back. So you want to get them attention, medical attention. A lot of the time, there are some times where people will try to, like they'll come out of it, they'll kind of be in a little bit of a haze, or they don't know what just happened.
Right.
There are times where they can go back into a withdrawal state because they need the substances again. So it's, you want to make sure.
Quickly.
Yeah.
Wow.
It depends too with the nasal naloxone. So that's the one in the nose. We don't have it as readily available.
Is that what we're moving towards?
I would think so. Yeah, it's expensive, but we have heard that they're going to be coming to post-secondaries after the recent UVic death.
Yes.
So they will be bringing that into post-secondaries. I'm not exactly sure what that looks like yet, but that's something we're moving towards. A lot of people, there's stigma around using the needles. People aren't comfortable with it.
Right. Or people not knowing if they're doing it correctly.
Yes.
But if you get an naloxone kit, then you get the training as well.
Yeah. The pharmacists, they can walk you through it too. If you're getting through the pharmacy, Access Youth Bus, they do have kits. You can get kits from Share. We have been bringing kits to community events if people wanted to do training on the spot. So they're pretty accessible and it's free, which is nice.
Yes. So do you recommend that people reach out and get trained and have a kit on hand? And where would they keep it? In their car, or like how big is it? Can you carry it around? Or
you could carry around. They are bigger. They're not as easy to carry around, I would say, but
so you couldn't just put it in your pocket or your purse and have it?
You can put it in your purse if you have a bigger purse.
You have a big
Maybe
purse.
not a small purse, but a lot of people will have it hanging off their bags or hanging off their bikes. So the kit's about, I'd say, yay big. It's pretty light, so it is compact. You could store in your car. You do have to be careful with temperatures because it's not the best to store in your car.
Right.
But at the end of the day, if you have it, it's better to not have it.
Okay, so you had mentioned that it works for some, but not all drug overdoses.
Correct.
Is there any way that you could harm a person by using naloxone? So it's a safe substance to use to prevent overdose or to treat an overdose. So there's no concerns there.
No.
Okay. No, that's good to know. Thank you for sharing that because it's something that I've always kind of wanted to know a little bit more about. So we were talking about these different services that you have and that you're connecting people to. Why do you think it's important to have them connected to these services? Like, why do you need to have more than one service?
I would say because substance use there's no cookie cutter answer. It's going to look different for everybody with what they need. So you're going to need people. Different places are going to have different focuses, and I think you can have harm reduction, people who still want to actively use, but in a safer way. You could have people who don't want to use anymore. They want to go for treatment. People who have lost loved ones. I think just having it all connected, because if you're having one conversation here, maybe there's a little bit more that they need, so then they're able to branch over and keep it all connected. And I think it all comes back down to community and helping each other, and it reduces the risk of those gaps in between and people getting lost in the cracks.
And I guess some folks aren't, they don't have the means to connect themselves, right? You don't know where to go and you don't know how to reach out, or how would they find you? How would they get in touch with you or find out about you, people that need your services?
So we do have a website, so it's tri-cities.cat.ca.
That's not an easy one.
No, it's not. Or they can reach out at info@tri-citiescat.ca. We put together an extensive resource list so we can help. If somebody's looking for something, we can help point them in the right direction. Or a lot of the times too is breaking down that stigma, as people want the help but they don't know how to, or they're feeling stigmatized because of their use. There's a lot of judgment around substance use, and what we have seen is, if you're looking at the statistics, there's a connection between the unhoused and substance use, which is not who we're losing. Yes, it's happening, but we're losing a lot of people in the privacy of their own homes. It's males in from 30 to 59, so it's not exactly the population that people think that we're
Right.
losing.
We always think the vulnerable population
Yeah.
are the unhoused folks. And can you talk maybe a little bit more about that? Because we used to talk about the opioid crisis or the overdose crisis. Now we're talking also about the toxic drug crisis.
Yeah.
Can you talk about, are they interconnected? Are they different? Just a little bit about those terms.
Yeah, so the overdose crisis and the opioid crisis is how it was originally declared, and that was because it was around the opioids and fentanyl. But then as things have evolved, it's more than just those who are using opiates. We're seeing it in stimulant users. It's getting mixed in with stimulants. Also first-time users, they're experimenting. So it's more than just an overdose. It's even small amounts can be
So
fatal.
even a first-time recreational drug user, somebody just trying it for the first time, is at risk of that fentanyl contamination being there?
I would say a higher risk too, because they don't have that tolerance, so they're not.
Okay.
So for those who are actively, heavily using, they're building up that tolerance because the fentanyl is in everything. It's very hard to find a substance that's what you're wanting or what you're looking for. That's going to be mixed with a whole bag of things.
Oh, okay. So it's scary,
Yeah.
it's dangerous. Are there safe injection sites or anywhere where people can get drugs tested before they use them in the Tri-Cities?
Not within the Tri-Cities, and I think that's something that we could definitely improve on and work towards, and finding those wraparound services and finding a space where people can actively use and be safe and be
Yes.
monitored. Outside of the Tri-Cities, though, we have Purpose, so New West, they will do the testing. They have the fancy machine that breaks it right down, which is it's kind of interesting on a science level to see what's actually in your substances, and they only need to take a small sample, so they're not taking your whole sample, your whole
Right. And
your
this
whole
is
substance.
a free service and
service.
no judgment, no questions
judgment.
asked?
Yeah.
Okay, now that I think, I can certainly see the value in that. Another issue I guess we have, like you say, it's almost a hidden crisis in some ways because people are going into their homes, into the privacy of their own homes. Now it's, there's restrictions on where people can openly use drugs. So do you think that pushes people maybe back down into the back alleys and things where they're at higher risk?
100%, yeah. Because people they're afraid to talk about it, and because you're automatically judged if you're using substances, regardless of why they're using substances.
Right.
I think one of the things we can do better as a community is just learning about why people use substances. There's going to be a whole list of reasons, and there's people who are functioning and using substances. Like, it doesn't have to be like a negative, it's not a negative thing all the time.
Right. Can you talk about just quickly some of the reasons why people might be using drugs? Like, I think there's some misconceptions still, and as you say, a lot of stigma attached to it. What are some of the range of reasons why somebody might be using drugs?
So I would say a huge part of it is self-medication. So just trying to regulate yourself.
Would that be mental health trauma or physical trauma or both?
Yeah, both, yeah. Looking at masking some sort of trauma, or it's maybe prescriptions, like it's just not, the tolerance level isn't there anymore. Some people just like to alter their brain,
Right.
their brain
But
chemistries.
that may be also leading back to some sort of trauma or some pain they're trying to deal with.
Yeah.
What do you think, what would help? Like, do we have enough resources in place, or can we do more?
I think we can do more. We can always do more. I think, like I mentioned, just having some sort of wraparound service and safe places to go for people to use substances, and really just bringing back compassion and community and education is huge.
Right.
So I know Naloxone's been doing a really good job of bringing them into the school system, just talking to youth and even maybe starting that conversation a little bit earlier. So with the TCAT, we do, a lot of the times we're talking to young kids, and
Right.
I know sometimes the parents will see the word we play Jeopardy, and so we have everything from mental health statistics, substance use. So as soon as you see substance use, parents are like, oh no, like
Let's talk
maybe
about
this isn't
that.
for you. But we try to come at it as like just building those core values of what is resiliency, what is empathy, how do we self-care, how do we take care of ourselves. Because taking care of ourselves is part of this as well. That's how we can't give back and we can't be community if we're not taking care of ourselves.
And I think sometimes we forget that, or we don't want to talk about those things.
Yeah.
So are you in the schools doing education, or where in the community could we find you?
So we've been doing a lot of community events. So like the May Days, Car Free Days, what did we just do? Oh, Pride. Just going to different events within the community, holding a booth. Like I said, we'll play Jeopardy. We try to make it interactive, the education piece. Our make creative visuals for just open. I think art is very powerful. So that it gives voice to those who can't speak, or creates a different lens, I would say. Yeah.
And I think we often look to our artists for social activism and those sorts of things. So there's definitely a strong connection there. And you had talked a little bit about artists in working with you and working, and I think you're an artist as well. So can you tell us a little bit more about the people behind TCAT? Did you call it TCAT?
Yes.
Okay. Yeah. Behind TCAT, who are the people doing the hard work?
So we have James Musgrave, he's our chair from SHARE. We have Jennifer Blatherwick from Access Youth, well, formerly Access Youth. So she has actually done a really good job at keeping us on track with the budget. Okay. We have Samantha Chong, who is our toxic drug response nurse. And so each CAT has a nurse on the team. So she helps us with the statistics, brings in the trends of what's going on within the community.
Keeping some data and watching what's happening. Okay.
Yeah. We have Cody, I'm going to mess up his last name, sorry Cody Grovenfeld. So he's the harm reduction coordinator of the North through Fraser Health. Myself, I'm the program coordinator. We just recently hired a peer coordinator, Michelle Jacobson, so who's going to be bringing in peers. So that's something we also have been missing. So we give opportunity for folks with lived or active living experience around substance use. So giving them opportunities to give back, opportunities to create projects, and give them jobs and a sense of belonging within the community.
Very important to be connected.
Yeah.
I can see you're doing some really good work and some hard work. Can you tell us, I'm just curious, you have a really interesting logo.
Yeah.
Can you tell us what it is and what it means or what it symbolizes?
Yeah, so a few years ago, Christine McKenzie, she used to sit on the TCCAT, and she created this logo, and it's the handprint, so it represents each of the communities. So we have Belcarra, Anmore, Port Moody, Port Coquitlam, and then Coquitlam, and in the center it has the heart.
So connecting them all through love and acceptance and compassion.
Exactly, yes.
No, it's wonderful. I think you have an event coming up on August 31st at Blue Mountain Park in Coquitlam. Can you share anything about that with us?
Yeah.
What it is and what will be happening there?
Yeah, so on the 31st, it'll be International Overdose Awareness Day. And that was created in 2001, actually. A lady who worked at Salvation Army, she was doing the needle exchange program, and she recognized the need. She's seeing a lot of the overdoses and a lot of loss. So the day was made national to remember those who have lost their lives, and also to bring about education and prevention within the communities. So our event will be held at Blue Mountain at the Scout Hall. And that will be, we're bringing together local service providers and local artists to bring those creative visuals to, in memorial of those who have lost their lives. We'll give space. We have a memorial tree for those to put the names of loved ones they have lost. We're going to be painting some rocks, or just words of inspiration and hope that we can leave around the community, just to blossom that hope within the community. And also give space for sharing their stories. We will have a number of folks who have lived experience who will be sharing their stories. And that in its own is really impactful.
It's very powerful to hear firsthand and put a human face to some of these statistics and numbers. I think it's really important. You know, I'd just like to thank you so much for coming in and sharing that, and for all the good work that you do. And hopefully we will see you on August 31st at Blue Mountain Park. And thanks again for coming in, Roxanne.
Thank you, I appreciate it.
Thanks for joining us this afternoon. We've been speaking with Roxanne Saxon from the Tri-Cities Community Action Team.
On August 31st, Tri-Cities Community TV was there when the Tri-Cities Community Action Team held their overdose awareness event at Blue Mountain Park in Coquitlam. Present at the event were members of Access Youth, Talith Kaloum Society, the Fraser Health Overdose Outreach Team, members of the Wondrous Tree Fellowship, and the Curtis Dream Car.
That's a harsh light.
Thank you for joining us today at the International Overdose Awareness Day. My name is Roxanne. I'm with the Tri-Cities Community Action Team. We welcome everybody. We're doing some interactive education. We have some displays of creative expressions. We're here to remember those who have lost their loved ones, lost their families. This is affecting our communities. I just wanted to thank everybody for coming today. So we have Talitha Kaloum Society with us. We have the Fraser Health Overdose Outreach Team. Thank you to Coquitlam for donating space. We have the Curtis Dream Car, Access Youth, and Naloxone. So I'm going to pass it off to Ernie with Spirit of the Children, who's going to do a little welcoming and opening for us. Pass this to you.
There we go. Tapow. Welcome. Tansena Wichwagan. Hello, my good friends, and hopefully friends that I get to walk with today and grow together on this special event. Very, very special event. Whenever we talk about overdoses, co-occurring disorders, substance abuse, mental health, we always think it's over there. It's over there. It doesn't affect me. But yet, whenever one of our sisters falls, whenever a brother stumbles, whenever we lose a mother or father, or even grandchildren, grandparents and grandchildren, it affects us all. Every one of us are affected by this. And it leaves that big hole right here. So today, on this walk, we are going to try to actually heal so that we can move forward. Never forget, but to actually be able to learn from this journey, this experience, so that we can grow stronger and we could keep our voices loud. But we always need support. So as we sit here in this beautiful park, we always got to remember the traditional peoples of this land, the Mi'kmaq-speaking people, the Coast Salish, and the people that have been here for so long. And unfortunately, I've worked with these people for a while. And we have seen, myself personally, I have seen a lot of them fall through alcoholism, through substance abuse, because they have that hole that I talked about earlier. Generations of just growing and growing and growing. So I think it's time for us to all work together so we can bring that healing in. So, from the Coast Salish people, we welcome you to this land. As myself, I'm a Nihiau from northern Alberta. I'm very honored to learn the ways of the people, the Longhouse, the Cedar, so that we can all come together and work together for this important walk. I brought some medicine along. Of course, we have cedar, sage, tobacco, but I brought this very special fungus, because what I'm holding in the palm of my hand is my society. It started because of this black diamond willow fungus. We call it grandmother medicine. And the reason why we call it grandmother medicine is we always burn it whenever great healing needs to be done. And I think today is a good day to bring that healing forward. So let us burn this sacred medicines. Let us remember why we are here today. Let us be connected from Mother Earth to the sacred medicine, to the Creator. Ninashkaman. I am grateful. Can you say that? Ninashkaman. Come on, Nancy, let's hear you. There we go. We do this, so hopefully you can smell this. You can all come forward. Smell this. Breathe it in. Let it sink. Center yourself. Take the medicine, put it through your hair so you can remember good thoughts. And we'll even smudge this camera so we could see clear. Well, my blessing today is so that we burn this together so we can always remember that our sacred hoop, all the people that we've lost, all the people that we come here to remember, in our culture we always believe the most wounded can become our most powerful, our most strongest warriors. And when they pass on, they don't leave us. They're still in our sacred hoop. But what they do is they become our totem spirits. They're right here. They're all around us right now. So when the Creator says, wrap your arms of wings of protection around our circle, that is all the people that we are actually walking for today. They are here with us today. They are reminding us to keep our head up strong, to keep our heart beating, and to never forget. Never forget. All my relations, Nanashkama. There's something wrong with them.
Feel the rich nutrients of the earth. Feel in your root system until it reaches the chest, the arms, the hands, and then finally your head. Beware of the sense of oneness with the earth. Feeling the sun shining down on your tree. Take a moment to step back from yourself and look at your tree and see how you are one with it, solid and steady. You're able to sway with the breeze and still be connected and grounded. And when you are ready, Gently come back to the here and now, carrying your grounded energy with you and for you to feel throughout the day.
Thank you.
Hi there. My name is Steve Kim, and I'm the Executive Director for Access Youth Outreach Society. And today is International Overdose Awareness Day, and we're in Blue Mountain Park in Coquitlam. And I think it's important for us to get together and continue the conversation so that no more lives are lost to a toxic drug supply out there. And it's also important to remove the stigma for those families and those who have been, have felt the pain of losing a loved one. And of that loved one in particular as well. So I think it's important that everyone tries to, in the future, come to an event like this so that we can continue to remove the stigma for all.
Yeah, my name is Trevor Tablotny. I'm here with the Curtis Dream car because my brother unfortunately passed away back in 2022 from a toxic drug overdose. And this was his car. We fixed it up and we use it to raise awareness about the toxic drug crisis and what's going on in BC, as well as to distribute naloxone and to answer mental health calls. So we're here at International Overdose Awareness Day, which we participated in before. This is our first time with Tri-City Community Action Team, a wonderful group. We just finished doing a march in memory of those that we've lost to overdose. I'm just some guy that that lost his brother. I'm not grieving brother, but I'm just some guy that's watched a lot of people harmed by drug policy and lack of action, and just half measures, half measures by politicians to remain voted for or in order to get voted, and really the integrity behind it is half. We're halfway there. And there's evidence that numbers are coming down here and there, but it's not coming down fast enough because we're just not doing it at the rate that we need to do. Just as much as this day is about remembering people, there is also, this is an issue that's now been highly politicized. I know that the conversation as of late, both federally and provincially, has moved away from a conversation of harm reduction, and they're now closing sites across the country for safe consumption, and they're taking away harm reduction supplies. And they're now having a conversation about treatment, and in some cases they're talking about forced treatment with an institution. And I definitely have questions for Mr. Rustad in regard to how you're going to protect people if that is your plan moving forward. Any time we've had a government institution in the past, it's been a recipe for abuse of marginalized people. And I have questions as to how there's going to be oversight or any form of protection for these people. And the other question I have is, you claim that this is common sense, but if I was going to talk to you for a minute about common sense, my brother, we forced him into into treatment. We forced my brother into treatment, and it did not stick. And he went on his own accord and on our dollar to these private facilities, and he did. And again, it did not stick. My brother was really, really trying when he died. He had recently left. I didn't even get to see my brother on his birthday because of the treatment facility that he went to. They would not let me see him because I was not on a specified list. Is this how we're going to treat people when they go into treatment? And how do we expect that to produce results? I don't understand. And you're talking about further, you're talking about answering damages from institutions by institutionally forcing people into a non-consensual based model. I think we need more consensual based treatment made available. Currently, I have a friend that was told it'll be 3 months before he can get into a facility. And I think the conversation needs to be made in favor of providing more consensual-based treatment beds and scaling up evidence-based treatment for individuals that are dealing with substance dependency issues. And we really need to focus on an approach of kindness and awareness, and that's part of what the Curtis Dream Car is for. We're all about spreading kindness and understanding, and talking about evidence-based models for treating this particular crisis. For those that would like to get in touch or go for a ride, our website is curtisdream.com. You can also find us on Instagram, and that's at Curtis Dream Car.
Ready?
Hello. Hi, Trevor. Oh, awesome.
Ready?
That car.